most of us at some point are going to have some degree of hip and knee pain. Once it's bad enough to seek medical attention, a proper diagnosis needs to be made, and how the knee and hip pain affects the quality of life determines what, in terms of treatment, is going to be rendered. So a correct diagnosis needs to be made. Oftentimes this is from a careful history, that means answering questions, a physical examination, and usually x-rays. X-rays can determine how bad or how severe one's arthritis is, and then a customized treatment can be rendered. Usually that'll mean joint replacement, and when to have joint replacement is really dependent on how much the joint pain affects your quality of life and limitation of function. Once a patient decides to have a joint replacement, let's talk about hip replacement for a moment. The decision of what type of joint replacement and, more importantly, what surgical approach is used needs to be made. This is discussed with your doctor, and one of the more modern methods is to use what's called an anterior hip approach. This is where a specialized table is used, there's no muscle cutting, and the recovery tends to be a little bit quicker, and there are no postoperative restrictions. Minimally invasive joint replacement arthroplasty embodies many different criteria. First, the surgical approach used, the degree of muscle cutting, and what that determined by is how much deformity or bone needs to be resected. Minimally invasive surgery can be set by the preoperative discussion, the expectation of the patient, and how quickly the recovery is going to be established. At Orthopedic Associates of Central Maryland, we offer the full spectrum of joint replacement arthroplasties. The main joints replaced are hips, knees, and shoulders, although we do offer elbow and finger arthroplasty, to name a few others. Joint replacement arthroplasty and the success of joint replacement arthroplasty is a team approach. At Orthopedic Associates of Central Maryland, we approach this from the preoperative visit, preoperative preparation and education, and the full spectrum of postoperative rehabilitation at our physical therapy offices and follow-up visits at our office. At Orthopedic Associates of Central Maryland, all of our physicians are board certified, and most of us have fellowship training in different specialty areas. This specialty training allows us at Orthopedic Associates of Central Maryland to offer our patients the most cutting-edge modern techniques of surgical arthroplasty.